Transitioning from a student nurse into a certified registered nurse can come with several challenges. This presentation will discuss New Registered Nurse Burnout by Jezzyl, Kyla, and Sidney. A recent graduate registered nurse is working on the floor. This is her 5th shift in a row. She is scheduled to work tomorrow and is just being asked to stay an extra 4 hours. This nurse has only been out of school for a month and has a full patient load, which includes 8 patients. This nurse is only 4 hours away from receiving overtime hours this pay rotation, and she is only halfway through the rotation. She is working with nurses who she is intimidated by and often is afraid to ask them for help for fear of them thinking she is incompetent. The following is a video clip showing the worker burnout new nurses like this one can be faced with.
Hi Kyla, how are you doing today?
I'm doing okay. I'm just a little tired. This is my 5th 12-hour shift in a row, and they asked me to stay late tonight, and I work tomorrow too, so just a little tired is all.
That sounds very rough. Well, I have your report for today. Are you ready?
Yeah.
Okay, so in 10 bed 1, I have a BS, 63-year-old, just had post-op knee done. Just got back from the OR 6:30 here. The next vital signs are due in 15 minutes.
Okay.
10 bed 2 is AM, 45 years old with uncontrolled diabetes.
Okay.
BGMs due every 3 hours. And 30, I have CG, 65 years old. Day 2 post-op in the right hip here. It's complaining of pain just now before shift change, so I haven't had a chance to do that. Last I had analgesics around midnight.
Okay.
And on 40, I have MN, 23-year-old with abdominal pain not yet determined. Nauseous and vomiting. So it's been retching the whole time. IV med still needs to be ordered, okay?
Okay.
And then 50, I have JS, 28, who had that appendectomy. He's ready to go home today. You just need to follow up on which doctors he's gonna see afterwards.
Okay.
And on 80, I have KC, 72 years old, query dehydration. Has been having lots of diarrhea here. Stool sample is still needed, as well as MRSA swabs. Have any questions? Okay, good. Yeah. Oh, wait, I forgot to tell you, AD is very incontinent, and he's confused. So he's been trying to take off his tennis for the last few hours here,
Okay.
and it's been messy everywhere. So we just had it cleaned up, but I just thought I'd warn you.
Okay, thanks.
All right, see you. Have a good day.
Thank you.
What is worker burnout? Burnout is defined as a psychological state that is characterized by the following symptoms. 1. Emotional exhaustion. It is stated that nurses tend to experience higher levels of occupational stress and burnout than other professionals. This is an important statement as a correlation exists between burnout and poor quality of care. 2. Depersonalization. Depersonalization occurs in order to distance themselves from this emotionally draining work. 3. Decreased perception of personal accomplishment. Less experienced nurses are likely to experience emotional exhaustion due to the emotional demands of new and unexpected work situations. Burnout within the hospital setting can lead to increased financial costs in relation to staff sickness and turnover, as well as reduced quality of care. Factors influencing worker burnout. As the number of work hours are increased, nurses are more likely to experience emotional exhaustion and depersonalization. According to research conducted by Beaumont, Reed, and Spencer, there are 5 main factors that contribute to a new graduate RN burnout. Authentic leadership describes a leader who exemplifies honest, ethical leaders who treat others with integrity and respect. Nurses' perceptions of supervisors' authentic leadership behaviors will have a positive effect on perceived structural empowerment. Structural empowerment means having access to information, support, resources, and opportunities. Structural empowerment will have a negative effect on short staffing. Adequate staffing is important in delivering high-quality patient care. Inadequate staffing levels contribute to excessive workloads and high stress, which leads to negative nursing outcomes such as burnout, job dissatisfaction, which ultimately gives the nurse the motivation to leave their workplace within a year. Short staffing would likely interfere with work-life interference due to new grad nurses are more likely to get called out for extra shifts during their scheduled days off. These requests would interrupt personal time and taking days off. If unavailable or too tired to take extra shifts, new grad nurses often feel guilty, anxious, or selfish. Burnout itself has a negative effect on a new grad's job satisfaction. Existing fatigues adds to more worker burnout. The most likely explanation for higher levels of emotional exhaustion and depersonalization in younger workers is that professional education cannot always equip new graduates with the necessary skills to adequately deal with every problem situation in the workplace. Less experienced nurses are likely to experience emotional exhaustion due to the emotional demands of new and unexpected work. Nurses tend to experience higher levels of occupational stress and burnout than other professionals. New graduates may experience stress as they struggle to find necessary resources to deal with every new workplace challenge. Another source for high stress levels in nursing professions is heavy workloads. Nurses are required to provide care for serious and terminally ill patients. When faced with intense emotional expectations in the workplace, they may lose sensitivity towards the people they serve and develop negative feelings against themselves and the people they are working with. These negative emotions reduce their efficiency, job satisfaction, and quality of service. Statistics surrounding worker burnout. 66% of new graduates were experiencing severe burnout. 30% of new graduates had a high turnover in tension related to the disempowering work environments. 57% after 2 years had high turnover in tensions. Nurses reported experiencing the effects of sleep deprivation at a rate of 67.7%. Fatigue is a factor of 26% of nurses who are considering leaving the profession. Fatigue-related impairments are similar to alcohol-related impairments. Someone who has not slept for 18 hours is as impaired as someone with a 50% blood alcohol level. Nurses who work a shift lasting more than 12.5 hours are likely to make 3 times more errors. The risk of falling asleep nearly doubles after 8 hours of work. Fatigue affects all nurses, no matter where they work. 55% of nurses always or almost always feel fatigued during work, and 80% feel this way after they are finished work. Prevention and management methods. It is important to know when to say no in your work field. Although it is important to maintain respectfulness and good work ethic, you must be aware of your own personal work abilities. Be comfortable going to your nursing manager with any questions or concerns that you have. Make time for yourself. Debriefing with others about situations throughout the day and seek out any extra supports if required. Ensure you are getting adequate sleep each night. Balance your workload. Do not be afraid to ask for help. It is better to have help from another healthcare professional than completing certain tasks on your own.
Now, we are going to go over specific strategies the nurse in this video could have used to avoid worker burnout. In this video, it is obvious the new grad nurse has her hands full. Not only does she have a large workload for the day, she has just agreed to work later than she had anticipated. This nurse is suffering from worker burnout due to these factors. There are several ways nurses can avoid worker burnout, such as knowing when to say no, as previously mentioned. If this nurse is feeling overwhelmed, she could arrange for a meeting with her nursing manager and explain that she needs to take some time off and to make time for herself. Although this is easier said than done. New nurses are often intimidated by their nursing managers and do not want to seem weak. If this is the case, the new nurse could set up a scheduled meeting with the nursing manager so that she is less likely to back out of the plan, and make herself some short notes to take to the meeting so that she does not forget anything she wishes to discuss. This nurse also did not have the chance to ask the nurse who was reporting off any questions because she just walked away. So she could have asked the nurse to wait until she had a chance to review the information she just received to ensure that she did not have any questions. This could in turn help her to feel more comfortable and confident when interacting with her patients. It is also very important to have a support system outside work, such as family and friends, to debrief about stress with.
Although it is not always easy to say no and stand up for yourself as a new nurse, creating this presentation has made us realize how important it is to be your own advocate when you become a nurse and to take care of yourself.